We watch as a doctor tries to revive a young woman who suffered heavy blood loss after giving birth. But there's no pulse as her head rests in her mother's lap. It seems nothing can be done to save her. Seconds later, it's confirmed she's dead. Her name was Aminata, and she was 23, and she'd given birth at home the night before. Outside, speaking to a matron and holding her newborn granddaughter. Aminata's mother says when her daughter fell ill, they took her to a nearby clinic, but were turned away. There were no beds. This, another tragic story in a land where Ebola has cruelly exposed the shortcomings of a healthcare system that can't cope with everyday problems, let alone a killer virus. A child's vaccination is a rite of passage, but in Sierra Leone, what should be routine is for some laced with menace. This clinic has seen a 23% drop in vaccinations because mothers are worried staff could pass on Ebola. But the fear cuts both ways.
We are live from our New Englandville studios in Freetown this afternoon. This is News Hour.
Cecil Nelson is a respected journalist who made his own news last December. His wife Jacintha, who was pregnant and a diabetic, fell ill and was admitted to hospital with traces of blood in her urine, but it wasn't Ebola.
She needed help.
No one wanted to treat her because they thought she may have Ebola.
Yes. Yes. They couldn't actually touch her. They couldn't actually touch her.
She went into a diabetic coma and died. But more than 200 medical staff have lost their lives to Ebola, infected by patients they were treating. It's a healthcare system short of money, crippled by fear and unsure of itself that Ebola has attacked. Years of chronic underinvestment means some health facilities don't have proper sanitation or even clean running water. The hope is the current crisis will galvanize change.
So don't touch anything here.
This Dutch-run lab tests blood samples for Ebola in pregnant women in just 6 hours, much faster than usual, giving confidence to medical staff. This is the kind of equipment healthcare advocates say the government must invest in.
Part of mitigating against any future level of impact that this outbreak has had means we must invest in health system strengthening. And the time for investment is now.
As Aminata's body is taken away, the big question is, will the daughter she left behind grow up in a land with a healthcare system that is finally fit for purpose?